Hello Claire, my name is Ruby and I'm a student midwife. I have here with me your test results for the GBS swab you did last week. Are you comfortable hearing the results? Sure. I can't really remember what GBS was though. Okay, so the test results show you are positive for Group B streptococcus or GBS, and this is a common type of bacteria that many people naturally carry, and in most cases it doesn't cause any issues. However, during pregnancy there is a small risk, about 1 to 2%, that it could pass to your baby during birth. This doesn't always lead to illness, although on the chance that your baby does get sick, it can be quite dangerous as infection causes things like GBS sepsis, which is when the bacteria gets into your baby's bloodstream and can lead to complications like pneumonia or meningitis or even infection around the brain. Yes, I think I remember reading a brochure on this. Okay, great. Well, the good news is that GBS is well researched and there are ways to manage it, which I'll go through with you, answering any questions you have, and we can discuss your birth plan to make sure you feel well informed and supported. But before I go into treatment options, is there anything that you already know about the treatment of GBS that is an important consideration for you? Well, I haven't really looked into the treatment at all. I just really want to avoid a cesarean section. That's a completely valid concern. Thankfully, GBS is not an indication of a caesarean section, and because you've had an uncomplicated pregnancy to date, a caesarean won't be recommended unless there is severe implication for you or your baby. Okay, great. Thanks. That makes sense. Wonderful. So it is recommended by New South Wales Health that you receive IV antibiotics in labour, and this is given every 4 hours up until birth. For the antibiotics to work most effectively, at least 2 doses is preferred, and this will reduce the chance of your baby developing early onset GBS disease by around 80 to 90%. Alternatively, if your waters break before you go into labour, you will be offered an induction and immediate antibiotics to reduce the amount of time your baby is possibly exposed to GBS. But of course, the decision is completely yours. Okay, well, hopefully my waters don't break, but will the antibiotics have a bad impact on my baby? That's a great question, and I completely understand your concern, because while antibiotics for GBS are very effective in preventing infection, there are a few small considerations, mainly that they do disrupt the natural bacteria that help support baby's gut health and immune system. This usually resolves itself within the first few weeks, though. You might also experience some side effects of the antibiotics, like nausea or diarrhea, especially because the dose is quite high in comparison to other prescription antibiotics. Are there any other options other than the antibiotics? Yeah, because GBS is a transient bacteria, which means it comes and goes and may not even be present at the birth, some women choose to decline the antibiotics altogether and instead receive close monitoring of the baby during labour and after birth. And in that case, we are prepared to act quickly if any signs of infection appear in the baby. However, this is not recommended across New South Wales Health because of how rapidly a baby can decline when it is infected and how detrimental the illness can be. Okay, well, it does seem like those benefits of the antibiotics outweigh those negative effects, but I was really hoping I'd be able to be in the bath during labour. Can I still do that? Yes, of course. As long as you're okay with having the antibiotics, there should be no issue being in the bath during labour and then birthing in the bath. I also noticed on your birth plan that you were hoping to avoid interruption in the first hour after birth for skin to skin and the first breastfeed, which is great to hear, and there will be no impact on this because of the GBS results either. That's reassuring. Thank you. So, how will you know if the antibiotics worked or not? Well, after birth, we'll closely monitor your baby for at least 24 hours for any signs of infection, such as difficulty feeding, unusual breathing, or changes in temperature. In most cases, babies do really well, but if there are any concerns, we may take blood tests and start antibiotics. But if your baby remains well, you'll both be able to go home as usual. Okay, that sounds fine. Once you are home, please feel free to call up or come in at any point if you have any concerns about your bub. You know what's going on with your baby better than anyone, so you want to know if you think something isn't right. so that we can help you protect your baby. Thank you, that was good to know. Your questions have all been so valid, and I hope I've answered them all clearly. Was there anything else you were unsure of? No, I think that all makes sense. Okay, that's great. Now I know you've already hinted that you agree with the recommendation of antibiotics, but you don't have to make a decision today. So I've got a brochure here for you to take home with some extra information on what we've already spoken about today. So have a read and just think about what's going to work best for you and your baby. Okay, thank you. This has been really helpful.